Okay, we're here at the conference on pathogenesis and treatment and prevention, the IAS meeting of 2013 here in Kuala Lumpur. We're here with Eileen Scully, who's received an award actually 2 days ago. It's hard to think about in those terms, but it was 2 days ago. And the award you received was for the work you did in innate immunity. We're going to talk about that. And you're from the Harvard Medical School, Ragon Institute, and you're an instructor there. And you're a clinical physician, and you do research work in innate immunity. So let's start with, maybe why don't we start about how you got into the field, because it's always interesting for viewers and for possible candidates for the field of medicine to know, to see what they might be doing, the track that they might be taking.
So it's a great question. So I started, initially my research was in basic immunology, and that's what I did my PhD work in. And then my clinical work sort of led me into the field of HIV because I find it to be a compelling patient population and an interesting disease. Mm-hmm. So has both of the things that I love most. I get to see all different kinds of people, mm-hmm. and I also get to think about a very interesting disease as I treat them and work with them. Mm-hmm. And so then when I returned back to the lab after I finished my clinical training, all the questions that were sort of filling my mind that had been built up during my clinical training were about HIV, and specifically about the immunology of HIV infection, mm-hmm. and how we can either modulate that or harness it to improve outcomes in infection.
There's not a lot of work or workers or researchers in the field of immunology. The name I was thinking earlier was Jay Levy, who stands out with me as being the pioneer in that area.
Yep.
But there are some,
yes,
and I think it's a worthy subject because it may guide us in other ways, and certainly we need the immune system to become robust again if we can. And how do we modulate it to the point where it can really be functional or more functional or optimally functional? So tell us about your project specifically. How do you do what you do?
Right. So the project that I proposed here is to look at a specific type of cell in the innate immune system called the natural killer cell. Mm-hmm. So these cells look like lymphocytes if you were to see them, but they have a different set of receptors on their surface, meaning that they recognize things in different ways. Mm-hmm. And one of the advantages of them is that they recognize things in a slightly more generic way than T cells or B cells. T cells or B cells can be exquisitely specific for a part of a virus, a part of a bacteria, whereas NK cells and other innate type cells tend to recognize signals of stress or infection. So they recognize these things that signal something is wrong, although not quite as specifically what exactly is wrong. And because of that, they're poised to act much faster. Mm-hmm. So lymphocytes usually require, T lymphocytes and B lymphocytes they have to see their antigen and then they have to expand and make a whole different population, a whole expanded population of cells that recognize that specific thing. Mm-hmm. And so that takes a little bit of time, not a lot, but sometimes I think those very early moments when a pathogen first breaches the skin mm-hmm. or enters mm-hmm. the bloodstream are quite critical in terms of the
That's
clearance.
the first thing that happens, presumably, because the innate, just to give a background on the innate immune system, is the very basic rock core
conserved
functional,
from worms
way back,
to people.
Whereas the acquired immune system is very different. That's something that evolves because it needs to, and so forth. But go on with your
So
scenario.
The idea is that a lot of these strategies for cure involve waking up the virus in some way, mm-hmm. reactivating the transcription from the stably integrated virus. Mm-hmm. But then the next question is, what will eliminate that cell now that you've woken the sleeping virus?
In this process, yeah.
Right.
Mm-hmm.
And especially when you consider that many of these interventions are going to take place under the cover of antiretroviral therapy, mm-hmm. right? Because we certainly don't want to have active replication and seeding of new reservoirs, because that would sort of defeat the purpose. So in that setting, if you're taking antiretroviral therapy and you're not having full production of virus, it's not clear that you'll have the full complement of potential antigens produced by the virus to be recognized by traditional T cells and antibodies.
There won't be any war to happen or battle to do battle.
Right. So if they're not waving the flag, how do we know that they're still camouflaged well within the system? There are, however, some subtle signals that come with dysregulation of genetic material, and some of those lead to stress molecules, which are upregulated on the surface and can lead to elimination by the innate type cells, including NK cells. HIV, of course, has specifically evolved some mechanisms to downregulate those signals. And so the approach I'm going to try and take is to couple the reactivation with an inhibitor of NEF, which is an accessory protein of HIV, to see if I can maximize expression of these stress molecules to allow elimination of these cells very early, before you have full production of intact virions, but in response to this signal that there's DNA damage that happens with transcription of HIV RNA.
Now, when you say very early, you mean very early in the process of a person being infected and then
No, I
acute,
mean
or?
very early in the process of reactivation.
Oh, okay.
So
and just as a subject that comes in and is treated in this
right,
procedure,
for a
with
cure
this process.
strategy.
Yeah, okay, gotcha.
Exactly.
Okay.
And I think one of the other potential advantages of it is by trying to target the virus using a virus-specific protein, it could potentially limit toxicity, because, you know, quite frankly, as a clinician, I want to make sure that any strategy that pushes for cure is a significant benefit and is safe, because we do have effective antiretroviral therapy, and I would never want to subject a patient to a treatment that would incur more danger than to continue on their therapy. So I think that's an important balance as we move the field forward.
It also complicates your process or your protocol.
Yes, yeah.
But I think it's worthy to note exactly what you just said. It's really a process that has to be thought through about, are we going to have enough of this going on to actually make the process that you describe functionally worthy.
Right, right. And I think, you know, that's why I think doing the basic science work to see what's possible is really important groundwork, because I think, especially if we learn things about the kinetics of the response, how long it takes for these things to happen, and how long the effect goes away, we could more rationally design studies that might be more similar to chemotherapy protocols, where you have pulses of different therapies, where you get a coupled therapy and then you get it again in a month, and then you get it, as they describe chemotherapy as cycles, right? So can we get enough information about what the durability of this intervention would be and what the time course would be, so that we could potentially design a real rational intervention
that works exactly the way it should be, based upon the time parameters of evolution of what it's doing, the process of what it's doing.
Right.
So this program that you're doing, I did talk with Steve Deeks about a little bit about the sense of what is the lab work that you're going to be, what are the assays that we're going to be able to do that might be necessary to maybe evolve, maybe some that we don't have yet, or assays of certain aspects of what we're doing. So do you feel that we have what it is that you need as far as assays to understand what's happening?
So I think at this stage, we're still in early days. I think there's actually been some wonderful data presented at the meeting already, showing how you can really find very sensitively small populations of cells that are actively transcribing HIV, which is these cells that we want to find. I think there's some exciting new developments in the basic science world that are allowing us to actually mark RNA by fluorescence, so we can identify those cells by flow cytometry, which, while it's kind of a complicated, scientifically it's complicated as to why that's better than PCR, but in the short, it could potentially allow us to get these cells, to isolate the cells before we've done all the things we need to do to look at nucleic acid. And when you look at nucleic acid, you have by definition lysed the cells and extracted the nucleic acid. So it takes you sort of a few steps away from being able to look at those cells and see what stress markers are they expressing, what stress markers are they not expressing.
So all of the science is in place, or at least so far as you...
I think we're right at the edge.
Yeah,
we're right at the edge, and we're pushing that edge, which is, I think, one of the other really fantastic things about HIV research always, is that, you know, from the history of bringing a drug to market and to patients faster than had ever happened before to now, I think it really has given us a tremendous opportunity to move the field forward in many ways.
Just as a little side light here, we've been having problems in the convention center with the electricity, and the lights all went off except for our lights. So let's keep the light on your program here. I'm really impressed with the work that you're doing, and I think many very deep thinking scientists, I know certainly people like Danny Dweck and others, and certainly Jay Levy, as I mentioned, have been so enamored with the fact that we've got to see what the immune system can do itself. I know the virus, the one thing we have to know, and we certainly say to people that that have been through this, it's a very, very complicated, very devious virus.
Yes.
It finds ways around, it mutates, it does all kinds of things.
It's a very worthy foe.
So coming back, you know, like Betty Korber said, the very basics,
Yeah.
you know, is probably important, and certainly the most basic thing we have is the innate immune system.
Yeah.
So it's exciting to see you're doing this work, and I certainly wish you all the good luck with it, because it's
Thank
a
you.
tough virus. But the reason you're in this is because it's challenging. Did you not just say that?
Yeah.
That's
right.
But people that want to get into this field have got to know that if they want the ultimate challenge, the ultimate Rubik's Cube or whatever it is very complicated. It's a field that will never leave you wanting more challenge. It's
No.
always there.
I think of the fields of research, scientifically it's incredibly challenging and rewarding.
Yeah.
And also it's one of the few areas in either basic or clinical science where there is really an opportunity to engage more broadly in the other things that are going on in terms of the social programs in sub-Saharan Africa and throughout the world here in Kuala Lumpur.
Yeah.
And so I think it is something that you can never be bored, and you will always be excited
Challenged.
about the next possibility.
Well, thank you so much for being here.
Thank you.
And I want to visit with you. We were just talking about that this morning, 10 years down the road, and see what happened.
And I I hope I have exciting
The
things
same-
to report.
And the same sense of excitement and interest and experience that you have today. Thank you so much, Eileen. I appreciate it.
Thank you.